Well, let's now focus on the Nipah virus in Kerala, where 2 more people have been identified with symptoms of Nipah virus infection. The Kerala Health Minister Veena George has said in Kozhikode yesterday the 2 are among the 20 high-risk contacts of the 12-year-old child who died, and the boy died at a hospital early morning on Sunday. The samples of the boy, which were sent to the National Institute of Virology in Pune, confirmed the presence of the Nipah virus. Now, Nipah virus is spread by the saliva of fruit bats, and the central team visited the house of the boy to collect samples of fruits from around the house. The sample could help identify the source of infection and confirm whether the origin of the infection was through a bat. The team also questioned the family and those close with the deceased to identify the food that he had consumed and animals he may have come in contact with. Well, let's go across to Dr. Rommel Tickoo, Director Internal Medicine, Max Healthcare, for more on this. And Doctor, so worrying that Kerala, which is already dealing with COVID pandemic and seeing high cases, now has this one case of a death from the Nipah virus and 2 more suspected cases.
Well, this is really something to worry about, because we know that the mortality of this particular virus is pretty high. It's 40 to 75%. And already we are dealing with the ongoing pandemic. The positives are we are more prepared right now because of the experience that we've had it in the past. Kerala has had outbreaks in the past as well. This is the 3rd outbreak in the last 4 years. It started in 2018 in Kerala, when 18 odd people got infected and the mortality was very high. 17 people died. And in 2019, only 1 person. See, at that point of time, we were not well prepared. Only after a few deaths happened, we were able to diagnose the disease. But right now, we're more prepared. Only 1 person has been infected. He has unfortunately died within 4 days of admission. But now we have to make sure that the others don't get infected. The area, the village where it's found should have restrictions, and there should be active surveillance, tracing of contact, and quarantining those who have been in touch, or especially the ones who had symptoms like Nipah virus. The symptoms are same more or less: fever, headache, body ache, sore throat. And if it progresses to your brain, encephalitis, It usually becomes fatal. And that's when you get seizures, disorientation, drowsiness. So it is a dangerous virus.
And Doctor, if you could tell us more about this virus, for our viewers, this comes from fruit bats. And why is it that we have seen these outbreaks only in Kerala?
See, the fruit bats are mostly found in that area. The host is the fruit bat, and it can infect other animals like cats, dogs, sheep, and horses. And humans get infected when they are in direct contact with pigs or such animals. Or there can be infection when they consume contaminated fruit, which is eaten by these fruit bats. Or there's a human-to-human transmission. In 2018, the index case, the first case, got infected from contaminated fruits. And in this case, we don't know how this particular boy has been infected. So that is important, how it has come to this particular boy. And then we have to make sure if it comes from farms, pig farms, then culling of those pigs, cleaning, disinfecting that. If it comes from fruits, then we have to take precautions, clean the fruit properly, peel it off, eat it. I mean, it depends how it gets in.
And once it crosses to the human, then the human can go ahead and spread it, which is why they've found some 20 people this boy has come into contact with, and they're checking all of them.
Yeah, there's human-to-human transmission. It's a droplet infection, the way it happens with COVID. Close contact with an infected person. If he coughs, sneezes, or if you're in direct contact with fluids, blood, urine, then you can get infected. And the incubation period is 4 to 14 days. But as I said earlier, the mortality is very high, so we have to be extremely vigilant. We have to make sure that this doesn't spread. The positives are that right now in the healthcare workers, most of them are wearing PPEs. We are taking all the precautions. Even normal public is wearing masks. So I'm sure we'll be able to contain it. But yes, we have to be vigilant. We don't want this another headache in the middle of the pandemic.
Right, absolutely. Thank you so much, Dr. Tickoo, for joining us on the program.